Hi students, welcome to Long-Term Care. We are in Unit 1. In Unit 1, I'm going to talk about long-term care services. Long-term care is a range of services and supports you may need to meet your personal care needs. Most long-term care is not medical care, but rather assistance with the basic personal tasks of everyday life. These can be referred to as activities of daily living, and they would include bathing, dressing, using the toilet, transferring from bed to chair, caring for incontinence, and eating. Other common long-term care services and supports are assistance with everyday tasks, sometimes called activities of daily living as well, which would also include your housework, managing money, taking medication, preparing and cleaning up after meals, shopping for groceries or clothes, using the telephone or common communication devices, caring for pets, as well as responding to emergency alerts such as fire alarms. 74% of people turning age 65 can expect to use some form of long-term care during their lives. There are a number of factors that affect the possibility when you will need care. For example, age. The older you are, the more likely you will need long-term care. Gender. Women outlive men by about 5 years on average, so they are more likely to live at home alone when they are older. You also have disability. Having an accident or chronic illness that causes a disability is another reason for needing long-term care. Between ages 40 and 50 on average, 8% of people have a disability that could require long-term care services. 69% of people aged 90 or more have a disability. And then you have health status. Chronic conditions such as diabetes and high blood pressure make you more likely to need care. Your family history, such as whether your parents or grandparents had chronic conditions, may increase your likelihood. Also, poor diet and exercise habits increases your chances of needing of long-term care services. So for this week, make sure that you check your lecture review and have that complete by the due date. Also, please review the discussion board postings that are due this week and make sure that you're responding to 2 other classmates' postings, and then double check your weekly units for any assignments that you have coming up this week. If you have any questions, please let me know. Otherwise, have a great week.